So we are going to do a robotic assisted total knee replacement. The biggest difference between a robot assisted versus a standard knee replacement that you will recognize right away is you will have 2 additional incisions on your shin where we have to attach what's called the robotic arrays. There will be a stitch in each one of those incisions that we will remove at your first post-operative visit. The reason why we choose to do a robot-assisted surgery is it's a slightly more accurate surgery in placing your components in so that we get a better alignment and hopefully better range of motion and ultimately better wear characteristics and length of prosthetic time. So when we use the robot during surgery, the robot is not an autonomous device. What the robot is, it's a series of sensors or arrays that we attach to your bone, one to your femur, your thigh bone, one to your tibia. Those arrays are then connected to a camera, and the camera itself will then see the knee. We then register your knee right there. It's like basically doing an MRI right then and there of mapping your knee to get the contours, how good your knee is, how bad your knee. We also measure the tightness of your ligaments. That all together gives us a better positioning for what we call our blocks to basically resurface your knee in the best way possible so that you have the best motion and, more importantly, the best balancing of the ligaments in your knee.